22-year-old boy with a history of twisting injury. MRI was suggestive of bucket handle tear. On arthroscopy, the meniscus on the medial side is bucket handled. This is normal ACL. Lateral condyle is good. There is no chondromalacia noted. The medial meniscus, upon probing, was bucket handled. A diamond rasp is used for debriding and freshening the edges of torn meniscus so as to open vascular channels and for better union of a repaired meniscus. Meniscus is repaired with a zone specific cannulas using 2O fiber wire. Three fiber wires were used and they were sequentially tightened from posterior to anteriorly to achieve meniscus repair. Upon final probing, there is no more intrusion or bucket handling of medial meniscus noted. The meniscus is stable throughout the movements of flexion extension. Thank you.